for more than 20 years, she and her husband have really dedicated their lives and their money to global health initiatives fighting infectious diseases. Through the Bill and Melinda Gates Foundation, she has traveled the world working on treatments and vaccines for diseases like malaria and tuberculosis. Well, now they are focused like a laser on COVID-19. The foundation has already committed more than $300 million to finding treatments and vaccines. I spoke to her about where that research stands and a major weakness in the economy she believes the country has the chance to address right now. As you survey the scene of where we are right now in this pandemic, do you feel confident about our trajectory? Do you feel like there's a plan?
I feel like we still are at the beginning stages of this pandemic, that we've seen the first part of it. To reopen, we need to do far more testing and tracing, and we need to be very careful and go very slowly as we reopen. You should never be reopening in places where you've got accelerating disease.
Let's talk about the search for a vaccine. The Gates Foundation, you and your husband, Bill Gates, are very much on the forefront. You put your money where your mouth is, trying to fund finding a vaccine. What's the status of that right now?
Well, I think just as you're hearing from everybody else, it's about 12 to 18 months. We get information pretty much on a daily basis about the various vaccine candidates that are moving through that pipeline. Luckily, it's looking like there are a few good candidates. And to be frank, that's a relief.
There was a report that the administration has an initiative, Operation Warp Speed, and that the goal is quite ambitious to have hundreds of millions of vaccine doses as early as January. I asked Dr. Fauci, is that even in the realm of the possible? He said it was. So it may be possible. Do you think it's likely, knowing what you know about the search for a vaccine?
Boy, that would be lucky to have hundreds of millions of doses by January. I'm not sure how likely that is. These things take time because we have to know that they're safe. So I'm hopeful, but would I say it's likely? I'd hesitate a bit on that one.
Well, this pandemic has certainly exposed weaknesses and strengths. You're focusing on one of the weaknesses that's been exposed here, and that's how we take care of our caregivers. Why did you decide to take on this issue?
If we're going to look at reopening our economy, we have to take care of our most essential workers. 85% of nurses are women, and yet who's the primary caregiver at home? Women. Who's the primary one for educating the kids? Women.
What are the ramifications of that for society if the burden is falling so disproportionately on women?
When caregiving falls to women, what happens is they then can't go do their job in society. They start to lose income. Their family loses income. And so we have to look at what are solutions. There are policy, business solutions that can help.
What's the number one policy that Congress could enact to alleviate this burden on caregivers?
They need to start looking at a paid family medical leave policy. We are the only industrialized nation in the world that does not have paid family medical leave. And that needs to change.
When resources are already so strained, it's quite ambitious to say, now is the time we need more paid leave. How do you get people to want to act on this now in this time when, frankly, they feel nervous about that?
Well, I think we've always had this false narrative of this is expensive, so we're not going to do it. This is already costing us. It is costing us our health. You have to address this piece if you want to have healthcare workers, nurses out there, 85% of whom are women, caring for us in the right way. You don't want to break your healthcare system. So it's not that an either or, it's that it's a fundamental to actually reopening the economy.
You made no secret of your disagreement with the White House and the president's decision to halt funding for the World Health Organization. Do you find any fault with how the World Health Organization has conducted itself in this pandemic, particularly in the beginning stages?
It's not a perfect institution. No institution is perfect. And I think there will be time to go back and to do a post-mortem when we come out of this crisis. But I don't believe with any institution you do a post-mortem while you're in the crisis.
Your husband famously warned about a pandemic back in 2015. He said then we weren't prepared. Even so, are you surprised at how the U.S. has responded? Are you surprised we weren't better prepared?
I'm both surprised we weren't better prepared, but quite honestly, I'm surprised we've wasted so much time, that we haven't had leadership at the national level to get out tests in the right way, protective gear in the right way, contact tracing in the right way. With lack of leadership, there are 50 homegrown state solutions. And that just shouldn't be. When you see a country like Germany with national leadership, they were able to keep certain sectors of the economy open safely, keep people safe, mostly social distancing, and now start to slowly reopen based on the science. That's the kind of leadership we should expect as citizens in this country, and we're not getting it. We haven't gotten it yet during this crisis, and so you're seeing what's happening, and it's chaos.
That's pretty blunt. Do you lay the blame at the feet of the Trump administration?
I'm disappointed in what I've been seeing, yes.
What gives you hope right now?
I get amazing hope and inspiration from the frontline healthcare workers who are going in and doing their jobs every day in very difficult circumstances. And then I get massive hope talking to the scientists and the many partners from industry. When I see people coming together in collaboration to do the right thing, to share the science, to share what we do know and learn, that's the best of humanity. And it makes me hopeful, and it makes me know that we are going to get out of this pandemic.
Wow.
It's really interesting to hear her talk about some of the vaccine candidates, and nobody wants to put the cart before the horse, but saying that there are a few that look very promising. So it's very hopeful because they're watching all these different trials that are happening. They're funding a lot of it, and so they really know what's happening with the search for a vaccine.
Yeah, she sounded cautiously optimistic. I thoroughly enjoyed hearing what she had to say on paid family medical leave in this country, and this idea that you either pay for it on the front end or you pay for it on the back end as well.
Yeah, she's definitely fired up, a big advocate, and a lot of people are actually talking about that right now. Sheryl Sandberg, I think, from Facebook just wrote something on the same topic. So, caregiving and how we care for our caregivers, really relevant issue, more relevant than ever when we see so many people having to take care of seniors, also take care of their kids, and trying to do their jobs as well.
That was a good conversation, SG. Yep. Thank you for that. And you'd be hard-pressed to find anyone putting their money more where their mouth is than the Gates Foundation.